Good evening, everyone, and thank you for those that are joining us remotely today. To begin, I will pass it over to Dr. Fitzgerald to give us an update on the overnight changes related to COVID-19.
Thank you, Premier. Good afternoon. Thank you again for joining us. So today I'd like to advise that since yesterday we have 2 new presumptive positive cases of COVID-19 in Newfoundland and Labrador. The first presumptive positive case is a woman within the Eastern Health Region. She recently returned from international travel. She is currently self-isolating and is recovering at home with mild symptoms. The second presumptive positive case is a woman within the Central Health Region, and this woman recently returned from travel on a cruise ship. She is currently self-isolating. In both cases, contact tracing is ongoing by public health. I am unable to confirm or release any further details due to privacy. As I mentioned yesterday, we expected that international travel and the spread of this virus, that we would get cases related to travel in this province. So this is not unexpected. To date, this brings our case numbers to 6 confirmed or presumptive positive cases. In Newfoundland and Labrador, there have been 901 people tested, and of those individuals, 895 have been confirmed negative. There are 332 people in isolation, and these individuals are followed by public health. The public health measures we have taken to date have allowed us to take swift action to help reduce the spread of COVID-19. Our public health system is responding and operating as it should. We are ensuring that we test and find those who have identified risk of COVID-19. Today, we will have testing sites in each of the 4 regional health authorities. These sites will support our public health work to test and find new cases. The testing sites are by appointment only. Actions like these and the measures we have put in place are vitally important. This is public health in action. We are each doing our part by adhering to principles of social distancing, supporting our loved ones and neighbours who are self-isolating, and practicing regular hand washing and good cough and sneeze etiquette. By complying with these public health measures, each and every one of us in this province are helping to protect the health of our families, friends, and communities. Thank you for doing your part. I want to talk now about visiting long-term care facilities. Each of the regional health authorities have in place strict visitation policies. Please check with your local regional health authority regarding these policies. Elderly people are particularly vulnerable to this virus. Under no circumstances should anyone who is feeling unwell go into a long-term care facility. I also advise this for personal care homes and visiting the elderly at home. Now is the time to FaceTime or call your grandparents, not visit them. We need to keep them safe. We live in a time of rapid and constant communication. Our technology helps support us and connect us with our friends and family. Our province is known for its strong sense of belonging and connection within our communities. Even in these uncertain times, we are discovering new ways to maintain our sense of community and belonging. If you find yourself feeling overwhelmed, know that you are not alone. Many others are feeling the same way. We have resources to support you and your family. Visit bridgethegap.ca to access these services. Our COVID-19 website at gov.nl.ca/COVID-19 also has resources to keep you informed. I implore everyone to please take these rules seriously. Please do not have guests to your home. Do not have dinner parties. Please minimize your running around to do errands. Please work from home if you can. This will mean changing your patterns of daily life, such as grocery shopping, and moving that to once a week instead of several times a week. Our communities are one of our greatest strengths. Let's all continue to do our part to support each other and to reduce the spread of this virus. Thank you.
Thank you, Dr. Fitzgerald. As you know, earlier this week, through the advice of the Chief Medical Officer on March 18th, we we made a decision from the Public Health Protection and Promotion Act under Section 28 to put in some special measures. So this would restrict, put in place measures that would restrict people from traveling to and from our province. If you're arriving from outside of the province, not just from an international traveler, but also from another province, you would have to self-isolate for some 14 days. So to clarify that, that also includes workers from the oil and gas industries outside of Newfoundland and Labrador, or mining industries outside of Newfoundland and Labrador. So it's important, however, that we also maintain, as we said yesterday, essential services to our province. What I'm talking about, things like food, health supplies, and other essential supplies for our population. But any worker, even those with providing those essential services, must be asymptomatic. And what I mean by that is they are not showing symptoms of COVID-19. And if indeed you are uncertain about this, we want you to call our 811 number. However, to supply those services and provide those services to our province, there are exemptions. And today we have the exemption order online. They would include people like truck drivers that supply food services to our province. Sometimes it could be crews on airplanes. Some of the oil and gas workers that work in Newfoundland and Labrador on our offshore rigs would be another example. Those that supply critical infrastructure of our province's infrastructure, supply those maintenance servicing. And also, some questions that would have came out of yesterday's announcements would have been particularly around in Labrador, in Fremont area, from Quebec into Lab West, and into Blanc-Sablon into the Straits of Labrador. So there are exemptions for people that live in those areas, as they are completely both socially and economically integrated into our province. So these measures are now, and these exemptions are now currently online. And as part of the process, these are reviewed every 5 days. But I want to send a message to people in our province that compliance is required. We have taken some of the strictest measures within this country, and now we are dealing with COVID-19. So international and national travelers coming to Newfoundland and Labrador, and those of you that are coming home on vacations or coming home from a workplace outside of Newfoundland and Labrador, a 14-day isolation period is absolutely in place for people coming to our province. We are also asking travelers entering to fill out a form, which is a public form requesting information and contact information. This is important to you, it's important to our province, it's important to our communities. Also, there's a public reporting form which is available online through our COVID-19 site. We talked about this at great length yesterday. And these are people, unfortunately, in our society, in our communities, that may not be taking responsible action. So this form is available for people to actually provide information to government to determine and make sure that people do remain compliant with the actions that we are taking. As Dr. Fitzgerald said, it's important that we stay inside. It's important that we shop when necessary, as been mentioned, once a week, but you also have the option to order in advance to pick up those things that you and your family would need. Social distancing is required. Make sure you practice that. And washing. So I'm asking people in our province to take this seriously. This is important to protect your own families and to protect yourself. Please do not compromise your health. Dr. Fitzgerald had mentioned also as well about the community testing sites in regions of our province by appointment only. This is to make sure that we continue to make the best use of our resources. So thank you, Dr. Fitzgerald, for this update today. We now make ourselves available for questions, and the Minister Hagee is also available remotely. So thank you.
Minister Hagee, did you have anything you wanted to say? Thank you very much, Kathy. Yes, I think I'd just like to reiterate some of the Premier and Dr. Fitzgerald's comments around social distancing. It's become a very much used phrase, but I think we need to translate that into everyday actions. We've got a significant number of returning seniors coming from southern United States. When you greet them at the airport, greet them outside. Do not hug them. It's hard when you've not seen them for a while. But these are sensible and responsible actions, as these people then need to go into self-isolation. The cab drivers in St. John's last night tell me that their Friday night was as busy as most Friday nights, only instead of going to pubs and clubs, they were taking people to house parties. This is not social distancing. The issue of the countries that have done well with containing COVID-19, such as Singapore and Korea, their culture is much more authoritarian than ours. They are much less individualistic by nature in general. And we have a challenge because the Newfoundlander has always been a free spirit. And I think we need to exercise that looking after each other that we're famous for, but we need to turn it round so that we put a distance between ourselves and our friends and family in order to keep all of us safe. I can't emphasize that enough. The healthcare system will not be able to fix this for you if this layer of defense does not work. One other thing, we all now have families that include our pets, and they are a valued part of our emotional support. From the point of view of letters and emails that I have received, for some reason there is a perception out there that vets somehow have been shut down. That is not the case. These are private, independent individuals who make their own decisions as to how and when to operate under these circumstances. My own local vet, very responsible, no chairs in the waiting room, social distancing, one visitor at a time. So if your pets are as important to you as they are to a lot of people, I think it's important that you acknowledge that there is a business there is a service there to be provided. I think having said that and dealt with the highlights of what I've heard about today, I would look forward to questions from the floor. Thank you for the opportunity, Premier.
Thank you, Minister. I'll now turn this over to our online operator for questions from the media.
Thank you. Please press *1 at this time if you have a question. There will be a brief pause while the participants register. Thank you for your patience. The first question is from Peter Callan of CBC. Please go ahead.
Question about people who are returning from outside the province. We're seeing lots of reports of people saying, on my way home from the airport, I'm going to stop in and pick up a few groceries. I need to check my mail. I've got a few errands that I need to run. Oh, don't worry. Then I'm going to totally self-isolate. What would you have to say to people who are taking that sort of course of action?
So I would certainly say that that's not in compliance with the law at this point, and that you are required to leave the airport or the ferry terminal and go straight and safely home. If you have friends who are able to go to the grocery store for you or run your errands for you, that's what we would recommend that you do.
The follow-up question is, a lot of people are concerned about, now that we're having more cases, not everyone necessarily self-isolated. There were people that they had in contact with, or they may have been out in the community, especially the case that you announced yesterday, where you said the person didn't immediately self-isolate. What other provinces, for example, Manitoba, have said, here's the flight they were on, here is the seat number they were in, or here was a business that they were in at this time. It allows people some sense of, okay, I was in there, I can now identify myself and hopefully speed up the process of identifying any contact. It's not, as the minister said, looking to name and shame who it is, but being able to allow people to quickly identify if they may be at risk. Why aren't we doing that here?
So if the person was symptomatic when they were in those, on the flight or in those businesses, things like that, and we felt that there was significant exposure, if public health through their investigation felt that there was significant exposure and that people needed to be advised, and that the contact tracing couldn't happen in a more private manner, then that would be something that we would do. If people are asymptomatic, however, that would not be necessary, as the risk of transmission is quite low, if at all.
Thank you. The following question is from Don Bradshaw of NTV News. Please go ahead.
Premier, picking up on what you were saying earlier about the self-quarantine for people coming into this province and the supply of essential services, you referenced truck drivers and those who might be carrying things like food and whatnot. Does the exemption apply across the board to all commercial truck drivers, or does it depend on what type of freight they may be carrying? In other words, for lack of a better term, would somebody carrying food get a free pass, whereby somebody who's carrying, say, furniture might have self-quarantine?
Absolutely. These are for essential services. If we have tractor trailers that are coming in here with a load of ATVs or recreational, vehicles as an example, these are not essential items for our province, and those drivers would be required to self-isolate. This is about essential services. This is about containing and delaying the spread of COVID-19. And I also want to remind people that self-isolation doesn't mean that after 12 days or 13 days you're not experiencing symptoms. It's 14 days because we're not certain when anyone that could be carrying this virus you would see symptoms. If it's day 1, day 2, day 12, day 13. So it's important that you absolutely self-isolate for 14 days. So if this is a trucker that's coming in with something that's not an essential service for our province, self-isolate for 14 days.
Following up on that, for those who are coming in on the ferry who are not commercial truck drivers, in other words, just regular passengers, ferries are taking a maximum of 250 people at the moment. How do you enforce the self-isolation for those people who are getting off the ferry in Port aux Basques? They may have to drive, let's say they're driving across the province all the way to St. John. How do you prevent them from stopping and getting fuel, for example, grabbing a bite to eat along the way, things like that?
Well, it's very difficult to prevent people, so what we're asking people to be responsible, to protect themselves and to protect others. And this is where it makes decisions like this a little difficult and not perfect. This is about protecting Newfoundlanders and Labradorians, and we are asking people, telling people that when they get off of that boat to go directly home and make sure then they self-isolate for 14 days.
Thank you. The following question is from Juanita Mercer of The Telegram. Please go ahead.
You mentioned that things like house parties are not considered social distancing, of course, but is the province considering closing non-essential stores where, again, large numbers of people would go, such as shopping malls or clothing stores?
So right now, on the advice that we're getting, this is not something that we've done. Not saying that it's not something we will not do, but regardless of what you do socially, practicing social distancing is extremely important and is a responsible thing to do. As I said, this is not only about protecting others from you, could be protecting you from others. So practicing social distancing in our society is paramount, and if indeed we have to take more aggressive measures, we're prepared to do that, but we're not quite there yet.
Follow-up question. If a worker is nervous about attending work in such a public venue, such as a store that's not considered essential, can they be penalized by their employer?
My understanding there is penalized by the employer. Like I say, we're asking people in this province to be responsible, to work with their employees, and for the employees to work with those employers. If there's questions around unfair treatment, well, we have provisions and we have things in place to deal with an employer who is not appropriately dealing with your employees.
Thank you. The following question is from Brian Medor of VOCM News. Please go ahead.
Dr. Fitzgerald, there were a group 6 or 7 or 8 kids in the cul-de-sac playing pickup hockey, basketball, whatever. Fairly close contact. So we called 811, and they suggested perhaps not even that type of activity outdoors would be acceptable around this time. But what would your position on such little kids' activities like that be?
So what we're recommending at this time is that if families would like to go out and have activities together, that is okay. If you're living together in your house, it's okay to go outside together. So you can play in your backyard, you can play in your driveway, in your cul-de-sac, but we would want you to maintain the principles of physical distancing from other people. So we would like for children to not be playing together as much as possible to prevent the spread of any potential viruses from household to household.
Dr. Hagee, I think this one would be for you. A situation in Edmonton today, or may have been yesterday, where nurses in that city refused to do the swab testing because they didn't feel that they had appropriate access to the N95 mask. Where do we stand in that regard, perhaps not only for nurses, I guess, but for all frontline healthcare workers and our supply of N95?
The appropriate protective personal equipment is determined by best practice and evidence. One of the discussions that we're having, particularly with the nurses union, but it would also apply to other disciplines across the healthcare sector, such as respiratory therapists and the like, is the role of N95 masks versus surgical masks with eye shields as part of the protection. The nursing union have one view. The evidence that we have had presented to us at IPAC and through the infection control people differs from that, and we're involved in discussions with our registered nurses union at the moment. As of last night, the National Emergency Strategic Stockpile released an order of personal protective equipment which included N95 masks in addition to our regular order. However, I'm personally not satisfied that that was what we asked for in terms of volume, so I will be talking to Minister Hajdu a little bit later on today to rectify that.
Thank you. The following question is from Beth Penny of NTV News. Please go ahead.
Dr. Fitzgerald, several municipalities shut down public playgrounds today, saying the virus has been found to live on plastic and steel surfaces for up to 3 days. Wondering if this is true and was shutting down the parks the right decision?
So what we do know that the virus can live on surfaces for an extended period of time in ideal conditions. So that means at the right temperature and at the right surface. It's quite cold outside at this time. However, I appreciate the precautionary approach that municipalities have taken. And because if children are playing together closely in time, there could be that slight chance that there could be transmission of not just COVID, but any respiratory virus. And it is difficult to clean these materials in between. So it's a weighing of risks and benefits, I think, at this point.
Just another question about the drive-through locations. Heard some concerns about that they're pretty, they're in public spaces. How can we ensure people have the proper privacy?
So I think at this point, if someone is availing of something in a public service, in a public space, that is their choice to do so. I think people will adhere to privacy as much as possible.
Yeah, for the community testing sites, these are by appointment only, I think,
Yes.
Beth, if that was where your question was going. So for the community testing sites, these are appointment only, and so the time and place and location of where you would receive that test, would be predetermined, and that time would be an agreed upon time with you and those individuals that would be providing that test.
Thank you.
Thank you. Once again, please press star 1 at this time if you have a question. The following question is from Peter Cowan of CBC. Please go ahead.
We've seen some concern from the town of Happy Valley Goose Bay. There's a flight that's coming in from the Italian Air Force. We're still seeing Air Force flights arrive. what sort of risks does this present to the community, and why are international flights still arriving in airports when the federal government has said they would all be centralized to a few key airports?
So places like Happy Valley Goose Bay has a role to play in national security. They've been doing this for many, many years. So the flight that you're talking about has been searched. The staff have been tested. The military has been tested. They've been kept in isolation. The people that work on the base in Happy Valley Goose Bay has been providing the military barracks that would be used, rooms, even to the schedule of those rooms in terms of cleaning, when they would be cleaned. So this is really about providing a military service, support services to a squadron that would be en route to the USA. So right now, the roles, the policies, procedures have been all developed by the base in Happy Valley Goose Bay, and Canada will and should continue its role in national security. So this is just not about a flight dropping into Happy Valley Goose Bay. This has been planned, and policies and procedures have been put in place and well developed in advance of this crew coming in.
And my follow-up to Dr. Fitzgerald, we've heard concerns from construction workers. There are still some large-scale projects. For example, Argentia, I believe there's about 800 people there. The Core Science building here, there's about 400 people working on site there. People who are concerned are saying, wait, large gatherings aren't allowed, but there's still a large group of people all getting together on this site every day. How much of a risk is it, and what would your advice be to workers who are concerned about that?
So I think we have to look at the situation. They're not, generally speaking, they're not necessarily crammed in together. So they do, employers would have to ensure that they could maintain the principles of social and physical distancing. And I think people, need to make sure they're washing their hands carefully and practicing good cough, sneeze etiquette. Really should be staying home if they're not feeling well. And all of that will help to protect the people who are there.
Thank you. The following question is from Don Bradshaw of NTV News. Please go ahead.
Thank you. Dr. Haggie, I'm thinking about essential services workers and specifically healthcare workers who go to work every day, put in the shift, and then go home to their families. What would your advice be for them in terms of self-quarantining? Should they self-quarantine from their family members or those they live with once they return from work each day?
I think it's a very good question, and I know it's a concern for healthcare workers and essential workers in that situation. The reliance, their protection, and thus the protection of their families, relies on adherence to infection control protocols. These are not new. They have been developed over the years. The commonest at this time of the year is around influenza, which, of course, as we know, is extremely common in this province. The difference being that COVID does not have a vaccine. So I think the reassurance they have is that if they are following protocols and washing their hands and observing good hand hygiene, which is ingrained in healthcare professionals, and maybe consider changing their uniforms before they go home and leaving uniform at work. Those kind of things are their best defense. Again, we are encouraging people where possible to socially isolate, and I appreciate that within a small nuclear family that might be quite difficult. Obviously, if they have any specific concerns related to their own particular geographic environment or circumstances within a healthcare facility, they should raise those with their manager or supervisor.
Thank you. And Dr. Fitzgerald, as a follow-up, we live in a society today of blended families and shared custody of children. And I'm wondering what advice you may have for families who are sharing children. In other words, dad has custody for, let's say, a week, and then mom gets custody for a week, and these children are moving from home to home, and their social circles are widening. What suggestions or advice would you have for families who are dealing with shared custody situations?
So obviously, if there's any travel, then the children should be staying with the parent who didn't travel for the 2 weeks of isolation. But I think as long as both households are adhering to the principles of, making sure you wash your hands well, of separating from others if you're not feeling well, not sharing utensils, all of those things that we've talked about, then, life has to carry on in that respect. And so we have to live within a realm of reality for those people. So I think it's important for everybody to make sure that they're just practicing good infection control measures within their households.
I think, too, if I could add to that, these are very stressful times on families and the family unit, regardless of how that family unit is developed or constructed. So it's important, too, I think, for everyone's health and mental health well-being is that we continue to provide that level of contact with parents, but keeping in mind, as Dr. Fitzgerald said, we practice with the due diligence and with the recommendations that are in place.
Thank you.
Thank you. The following question is from Brian Medor of VOCM News. Please go ahead.
What about taxis and buses? They're the main link, often the main link between airports and the general population. Say, for example, somebody calling a taxi is wondering, well, has that taxi come from an airport? Did they have a person in the back seat? Has it been cleaned since that? But is there any protocol there to protect not just the drivers of buses and taxis, but also people who may subsequently use that mode of transportation and a short time after, say, someone has arrived from an airport?
So information has been given and is available for different businesses to be able to ensure that they can provide a safe work environment for their employees, and that would be no different than for the public bus system or for the taxi industry. So there are guidelines that are available to ensure or to reduce the risk of spread of any of these types of viruses. And I think people have to take it upon themselves as well to ensure that they maintain their own protection and make sure they wash their hands well, and that they avoid touching surfaces that may be high touch surfaces, or to wash their hands after they touch those high touch surfaces.
Thank you.
Thank you. The following question is from Marie-Isabelle Rochon of Radio Canada. Please go ahead.
Thank you. I asked in the first round to ask a question also, and I wasn't taken into account. So is it okay if I ask 3 questions?
You can ask a question and then have a follow-up.
Okay. First, I'm wondering to have more detail about this form that people can fill online to report people. Why has this form been put in place?
Thank you very much for the question. One of the biggest concerns we have received is about people who are apparently not following the requirements of self-isolation. It has been very difficult to document specific instances because a lot of these have lacked specific information. And so in response to public requests, really, the form contains what we would consider a basic minimum amount of information to allow us to assess or investigate an allegation that someone or some company was not following the approved protocols. Currently, it is available as a downloadable form that can be then emailed back. We are working to have this totally online to remove the paper step, but there was some pressure to get something out there given the demand from the public. So that's why you see the form in its current format, and it will change over the next day or so.
Dr. Fitzgerald, could you give us more detail about the new testing areas, the car testing areas? So how many more testing is it possible to do here in the St. John's region? How many more than each day this week?
I'm sorry, I didn't get the question. I'm sorry.
So with the new testing area that has been put in place, how many more tests is it possible to do now that we have those places?
So those tests, clinics are set up to be for appointment only. They're being run through the regional health authorities, the actual numbers, I don't have how many extra they'll be able to do a day, but certainly I think we're hoping to do significantly more than what we have been doing with our public health nursing testing up to this point per day.
One of the things about the community testing sites, it reduces, exposure to those that, been asked to have the test done. And what's unique about this is doing it by appointment only helps, with we use to the best ability our resources. So it works, for our own staff, our own healthcare providers, but yet it allows the individual that would require that test and deem necessary to be tested, the appointment, process. So there is some efficiency in all of this, but it really is the most efficient way for us to do this testing in the community sites in supporting our healthcare workers, but yet indeed in supporting those that would need and has been identified to be tested for COVID-19.
Thank you. The following question is from Beth Penny of NTV News. Please go ahead.
Hi. Wondering in the two new presumptive positive cases where the two women had traveled.
If they were related to travel, they were both related to travel, yes.
Where they had been traveling.
So one had been on a cruise, the one in Central, and the one in Eastern had traveled to the U.S.
Do we know where in the U.S. or?
I don't have the details to that level at this point.
And just to follow up, is it still only one case is confirmed and the others are presumptive positive?
3 are confirmed. The 3 in Labrador Grenfell Health have been confirmed.
Thank you.
Thank you. Once again, please press star 1 at this time if you have a question. And the following question is from Peter Cowan of CBC. Please go ahead.
One of the questions people are wondering about is money. We've seen some businesses say we'd rather you not use it. Is there any actual evidence that this disease can be transmitted through money? Is it something people should be avoiding handling?
Certainly, I think coin would be more likely. You would be more likely to transmit than paper or non-coin money at this point. But everybody needs to practice good hand hygiene to prevent that. So, if you do exchange actual money, just make sure afterwards you use some hand sanitizer or you wash your hands if you can. And where possible, obviously, to avoid using cash. However, if you're using an Interact machine, you're still handling something that more than one person may have handled. So you still need to practice good hand hygiene after you make purchases, for sure.
Thank you.
Are there any further questions?
Yes, we do have a question from Don Bradshaw of NTV News. Please go ahead.
Thank you. Premier, returning to the issue of the supply chain, excluding items you mentioned like food and medicine that are required here, for stores and businesses that rely on non-essential products, let's say clothing, for example, obviously if that supply stops because of the self-quarantine for 14 days, those stores will start to see their stocks and their shelves diminish. What advice would you have for those stores who are still trying to stay in business? You mentioned earlier you're not requiring malls, for example, to close down and things like that. So for businesses that are still operational, but yet they're getting no new freight in, what advice would you give them?
Well, there's no question this is not business as usual. These are some tough times for the country, some tough times for our province. So all of us has a role to play, including our business owners. And I think the measures that we're taking today hopefully will prolong or will actually reduce, the period of time that we have to deal with this, in our province. So we realize it is tough times, for many businesses. the federal government and indeed the province have put in measures to support the business community, which therefore the expectation that would support the employees as well. So as a province, it's extremely important that we take this seriously. It's extremely important that we continue to work together, work with the federal government and the benefits that they put in place and the programs that they put in place for business owners and for the employees. So my message is these are not normal times in our province. These are not normal times to do business in our province. We must maintain the essential services for people in Newfoundland and Labrador. But those business owners that will be impacted, there will be programs, both provincially and federally, to help support them as well.
And as a follow-up, if I could ask about the tourism industry, following your announcement yesterday regarding the 14-day mandatory isolation period for anyone entering this province, domestically or internationally, I received a message from one tourism operator here on the West Coast who said they just put a bullet in my business. Obviously, 14 days for people who are coming here to vacation would eat up most of, if not all of that vacation time. So what do you tell tourism industry operators who may be getting ready now to ramp up for the season and are looking at having very few people coming into this province?
Well, it's, as I said, and the response would be the same, you know, for business owners in general. This is not a normal way of doing business. These are very tough times. And I understand, I've talked to many tourism operators within our province. We're seeing the traveling public, because we're asking people to even suspend travel, to expand for social distancing, and people to stay at home. So it's important that as we deal with this healthcare crisis, realizing that there will be an impact on businesses as well. And it's important for us as a province that as we get through this critical period, that we will be there to support our businesses, both provincially and federally, with an understanding that there will be less travelers and that people are asked to stay home. So once we get through this period of time related to COVID-19, we will continue to work and attract people to our province, which we've been able to do, and these tourist operators that will having a difficult year this year, potentially, because this is not just days, weeks, potentially months, and the impact on all businesses within our province, we know in some cases will be very profound, but it's important for us as a province to work together, and it's important for us as a province to be able to support those tourism operators, and I know both provincially and federally there will be support there.
Thank you.
Are there any further questions?
Yes, we do have a question from Juanita Mercer of The Telegram. Please go ahead.
Thank you. Precisely how many people across the province are currently awaiting testing, and how long will those people have to wait on average to get an appointment at the mobile site?
So I don't have the numbers of how many people are awaiting testing at this time, but we hope now that with the mobile testing site and an increase in capacity, that we will see a significant improvement in wait times. Although my understanding is that in most regions, if someone is calling for testing, it is being done within 24 hours.
And thank you. A follow-up question to that. Exactly how many tests is government currently prepared for in terms of access to testing supplies?
Access to testing, I'm sorry, I missed the last word.
In terms of the amount of supplies government has right now, how many tests exactly is government prepared to do?
We're prepared to do as many tests as we need to, and at the moment we have enough test kits to be able to do that.
Thank you. Can I ask a quick follow-up to that?
Quick one.
Thank you. I know you're currently only doing testing for people who have symptoms. Are there any plans to increase testing, for example, to everyone who has traveled?
So testing, we have to be sure that when we're testing that we're going to be able, that what we do is going to influence, or the test is going to be able to influence what we do. So at the moment, our biggest risk we know are people who have symptoms and have exposure criteria. So that is where our testing is focused right now. However, should things start to change and should we see a need to test other people, we will certainly do that. This is something that we are looking at all the time. We are evaluating evidence on a daily basis to determine what our response should be and what our next action should be.
Thank you. Thank you.
Operator, do we have any further questions?
Yes, we do have a question from Marie-Isabelle Rochon of Radio Canada. Please go ahead.
Yes, I understand that some bars in some little towns are still open. I was wondering how many fines has the government issued since the decision in Wednesday to give fines to people who don't, or to business for people who don't respect the new measures?
Excuse me, I'm not aware of any fines that have been issued. I'm not actually aware that we have been made aware of any bars that have remained open. Obviously, now we have the reporting mechanism on the website. This data, this information will flow more freely, and where appropriate, we can investigate. So the answer at the moment to that is there have been no bars brought to our attention who have been in breach of the regulation.
And maybe my last question would be, is there any plan in the next week to maybe close access to Newfoundland to travelers?
Close access to Newfoundland to travelers? Is that what you said? Is that
Yeah.
what yeah, well, we basically said that anyone traveling to the province would have to have a mandatory 14-day self-isolation. So we said that already. So right now, for only those people that are traveling to come home, we expect Newfoundlanders and Labradorians that are traveling away and they want to come home, this allows them to do just that. So this is some of the strictest measures that we've seen anywhere in this country. And we know we have some people that work outside of Newfoundland and Labrador, and even those individuals that will come back home, well, then they have to self-isolate for 14 days as well. I mean, I think the message is to people in our province is that last Saturday we had our first case. This Saturday we have 6 cases. So we've put in strict measures. We will continue to take more action if we have to. Stay inside. Take this seriously. We have a reporting form in place as well now. And the message is that everyone has a role to play. And please make sure that you practice social distancing, hand washing. These are key to prevent and stop and slow the spreading of COVID-19 in Newfoundland and Labrador.
Do we have any further questions from Brian Medore or Beth Penny?
We do not at this time.
Thank you very much, everyone. The time for questions has ended. Thank you for coming.
Thank you. The conference has now ended. Please disconnect your lines at this time. We thank you for your participation.